I don't know about you, but I used to find treating depressed clients depressing. And if you've ever taken one of our workshops or courses, you may be surprised to hear that, but it's true. In this short video, I'm going to tell you how I went from feeling overwhelmed by my depressed clients to actually enjoying working with depressed people. And so you can understand the uncommon knowledge approach, I'll take you through a case study of a particular depressed client I worked with and describe precisely what I did to help her. And finally, I'll talk about why I think the way depression is treated in the Western world badly needs to be rethought. But first, I just want to talk a little about where I'm coming from. Now, when I first started working as a therapist in the early 1990s, I didn't know what I know now. And I used to feel really worried when one of my depressed clients was coming in to see me. You know, I'd left my normal job to become a therapist to help people. And depressed people often needed my help more than anyone else. You know, sometimes it was usually urgent. You know, sometimes they were in so much pain they were suicidal. So it was a big thing. Now the trouble was that I felt a bit like I was letting them down sometimes. I knew I could make them feel better by relaxing them, but beyond that, I didn't feel I was doing much for them. You know, sure, they'd say that they felt better, but then, you know, they'd contact me again perhaps 6 months later saying their life was stuck again and they were feeling down again. And, you know, it was exhausting for me as well, trying to treat people in that way. Now, I'd find myself taking on their depressive attitude sometimes, and even the day after seeing a depressed client, I'd feel low and unmotivated. I'd get so lost in the outpourings of information they typically gave me that I wouldn't know where to start next time. You know, it was like I hadn't yet learned to see the process of depression, because I'd get so engulfed with all the content, with all the information my clients were giving me about their lives. And I could end up feeling as hopeless as they did. And I can even remember sitting alone in the upstairs room in the clinic where I worked at the time, dreading the next session with a depressed client, and actually hoping they'd forget to come in or they'd cancel. And I remember watching the clock, and if they were late, actually feeling relieved. Now, bearing in mind that at the time I really needed the money. I had 2 young sons to support and a mortgage to pay. So this was my career, but I was struggling with part of it. So how did I go from a struggling therapist to a successful one? Well, back in the early 90s, as luck would have it, I started working with the UK's largest mental health training company, helping deliver seminars on all sorts of mental health topics, including depression. And I must have sat through the day-long Human Givens depression seminar over 30 times, and it really sparked such a passionate interest that I started reading all I could on the research into depression, and there's a huge amount. And around this time I also came into contact with the renowned psychologist from Ireland, Joe Griffin, who had spent many years studying depression. And so I was able to start using a structured step-by-step strategy to treat depression, which I tried out on my clients. And much to my relief, I saw that it really worked. You know, it started to work for them. They were quickly becoming hopeful again, and I was able to teach them exactly what they needed to know to get free of depression, and importantly, of course, to stay out of depression in the future. Now, something I hadn't predicted when I started using this approach was that I started to get more business, a very welcome side effect at the time. My clients were going back to their doctors and saying they wanted to come off their medication. And these doctors were often in turn referring more people to me. And of course, my clients were telling their friends as well. Now, within a couple of years, I went from struggling to see 5 clients a week to having a 3 to 4 week waiting list. I was even able to stop doing my Yellow Pages advertising because word of mouth had become so powerful. And for me, it was such a relief to not have to worry about maintaining my business, but focusing on the therapy. I had my hands full with the actual running of the practice, and also being a father to 2 young boys. And the business was sort of taking care of itself. And for years after this time, I continued treating patients, but also more recently, I've been teaching this approach to Uncommon Knowledge's therapy students, or uncommon therapists, as they've come to be known, hundreds of whom are now out there helping other people. So let me quickly show you how this approach worked with a real client. And I remember working with a 32-year-old woman who I'll call Rebecca, who came to see me after she'd been diagnosed with clinical depression. Now, Rebecca had symptoms that you often find in depressed people, like poor sleep, feeling exhausted on waking up in the morning, little appetite, loss of libido, extreme black or white thinking, loss of sociability, loss of enjoyment in stuff she used to enjoy, like photography and exercise. And she was very anxious as well a lot of the time, and very low in energy. She was also ruminating continually. So typically for people with depression, Rebecca told me that she felt her life was going nowhere, and she constantly fretted over stuff like her unfulfilling relationship with a boyfriend, her job. She missed her friends but did nothing to actually contact them. And she even felt that she was aging rapidly, even though she was only 32. And Rebecca had been in therapy before, which hadn't done her much good. And also she'd been offered antidepressants, but refused to take them. So that was the situation. Now, in our first session, after hearing about Rebecca's problems and her symptoms, I set about helping her with the Uncommon Knowledge approach. And firstly, I described the cycle of depression, also telling her about her basic needs and why depression is always a result of needs not being met. And we discussed together which of her needs were lacking in her life at the time. So talking about the cycle of depression and also the basic needs she found fascinating, and it corresponded with her experience right away. And she also recognized how extreme her thinking styles had become, and teaching her about specific depressive thinking styles, teaching her a specific relaxation technique, all made a big difference. Now, we know that rumination causes depression, so anything you can do to help your client reduce the amount of worrying they're doing will have an immediate and rapid effect on the depth of their depression. And we know that depressed people have elevated cortisol levels in their blood, a stress hormone. So even though they may appear listless, very still, or inactive and lethargic on the outside, on the inside they're experiencing strong emotion and a great deal of agitation. I asked her to tell me about her resources, her friends, her talents, her abilities. And we also discussed how much she'd like to engage more fully in life again. Then, to help her on this route, I gave her a few simple tasks, such as taking some photographs to show me for the next session, and also going for a run, stuff she used to do. I also asked her to watch for black or white thinking, her own black and white thinking, and challenge her own thoughts when she caught herself doing it. And she left that first session feeling happier and hopeful, which of course is vitally important for depressed people. Now, in the second session with Rebecca, she came back looking a lot more relaxed. She showed me some of the photos she'd taken of a sunset, and she also told me she'd been on 2 runs. And she also said that she'd spotted her own black and white thinking and had successfully challenged these thoughts on occasions. So depression always produces a certain type of thinking, which once the depressed person can see, they can do something about. In the next session, we looked at her relationship with her boyfriend, and we also rehearsed what she'd say to her boss about the fact that he'd been demanding that she do unpaid overtime. And she wanted to ask him for a rise. In our third session, Rebecca told me she'd spoken to her boss and been offered a pay rise, but she was actually considering setting up her own business with two colleagues at work. She'd also spoken to her boyfriend, and they had decided by mutual consent to separate. And I want to make it clear that this wasn't something I'd suggested, but a decision that she'd made on her own. It had been a big worry for her. She'd also been using the relaxation exercise I gave her, which was making the world of difference. She was sleeping better. She could relax during the day when anxiety would sort of rear up, and get a sense of control back again, which is vitally important for anyone who's depressed. At our 3-month follow-up, she no longer felt depressed, and said she had a strong sense that she had safeguards in place in case she ever started feeling that way again. And that's vitally important that sense of control, feeling that you can stop it happening yourself. Unfortunately, research has shown that good therapy greatly decreases the chance of depression returning. So in this case, there were three main things I did to help Rebecca feel better. Firstly, and perhaps most importantly, I calmed Rebecca right down, because without that, the depressed brain is simply too stressed to learn and to take on new perspectives. And of course, when you're very stressed, then just relaxing feels absolutely amazing and tends to inspire hope that things can change. And we know that depression is a state of heightened arousal, even if it doesn't always look like that from the outside. So that relaxation is essential. Secondly, I got her to see how depression was affecting her thought processes. She learned to see this for herself and begin to tackle her black and white thinking that was causing so much anxiety, and that's vital to do as well. And finally, I got her to focus on her resources, what she was good at, and use practical problem-solving skills to address the worries she'd been having in her life, switching off the worries. I also had her do simple tasks that would re-engage her in life, remind her of her capabilities, and start improving her self-esteem and confidence. And of course, treating depression isn't always quite this easy. Rebecca was very eager to learn, very eager to get better and to try my approach, and she didn't suffer any setbacks during the therapeutic time we spent together. Sometimes a depressed client will be getting better, but will suffer some kind of setback and need more help. So of course, it's not always that simple. But now, talking about it like this, it might all sound a bit confusing or random, but actually I was simply following the principles of this approach. And as I say, of course, every client is different, but the principles are always similar, what we need to do to help them. And this is what makes it easy to use. It's a clear framework that stops you getting confused and lost in all the content of the client's story. In my next video, I'll tell you about a suicidal client who I found very tough to work with at first, but still managed to treat without drugs. Now, over the years, we've trained everyone from counselors to psychiatrists to nurses and doctors to NLP coaches and concerned relatives of depressed people as well. And also millions of people with depression have taken our free course on depression online. So this approach is understandable for everyone, and even those with no psychological training have been able to learn and make use of it to help other people and also to help themselves very effectively. So to sum up, although we're not anti-drugs per se, myself and the team here at Uncommon Knowledge believe that the social experiment of expensive psychiatry, if you like, and the overprescription of drugs has really failed humanity. Despite more people taking these drug products than ever before, depression, which used to be virtually unknown in traditional societies, is now at epidemic levels and growing. And right now, your neighbors, your friends, colleagues might well be miserable, and maybe life has lost its meaning for them. And now it's clear that the strong drugs and psychiatry institutions just don't work for many people. So the only way forward for our societies, really, I think, is to reintegrate the knowledge that we've lost, the wisdom of what people really need to thrive in life and to become more resilient. A time when people had easy access to trusted advisors like the kind of wise women or wise men in society who are in the community to help people. So with the current burden of depression, in the world, everybody needs to know why depression occurs and how to prevent it. This knowledge needs to be in the community. And if this doesn't happen, then our children and their children will grow up in a pessimistic, depressed, hopeless world. And of course, what we're doing just now is our next initiative towards making sure that things improve is putting our course How to Lift Depression Fast into home study format. And we'll be opening up the booking for that within the next couple of weeks. So do let us know in the comments below if there's something particular you'd like to see in the course. And I'll be sending another video in a couple of days. And in that video, I'll show you why my years working in a psychiatric hospital have made me so against the unprecedented availability of antidepressants in today's society. And I'll also talk about the therapist burnout, which is very common when people are treating depression, and telling you the story about the client who nearly made me quit. And I'm glad you were able to watch today, and please ask any questions and let me know what you thought of the video in the comments below.